Hi, Jay Barnett. Oh, Amarinda, you are on time, my love. Right, here we go. Let's put you on. Have we got it to work?
Helen, can you hear me?
I can hear you. We are live. Don't say fuck or bugger.
Oh my God, I'm fine. It's been too long.
It's
It's
been way.
been so long.
I'm just going to sort out my lighting. So I know that the summer is going because normally if I do an Insta live at this time, it's still really bright outside because I'm sort of in my garden. And
Yeah,
the light is just going, man. It's
I
depressing times, sad times, huh?
do you know what? It's like autumn's coming now as well. It's
I know.
like,
Tell me about it. Although
oh,
I do like the autumn, but I love the summer.
oh no. Well,
I thought that this
oh
represent.
my God, where did you get that from?
Oh, I don't know. It was gifted to me. Well, it was given to me by a friend of mine for my birthday. Um,
That is so cool. I love it.
and I have to say, I don't know about anybody else, but when you're going through cancer treatment and you have a birthday, you get much better presents.
Oh my God, silver lining.
Anyway, thank you so much for joining me. Are you at work or are you home?
Oh no, I'm home. I'm
You're
home.
at
Yeah.
So for anybody who doesn't know, do I call you doctor? Do I call you Amarinda? What shall I call you?
Helen, you
You're,
can call me whatever you want.
oh, I love that. So you are a dentist, basically, by trade, aren't you?
Yes. Yeah.
Yeah,
Qualified about 4 years ago.
great. And we met because we were at a sort of a fundraising sort of breast cancer event
That's it.
thing
Yeah.
a year ago, and you kind of always stayed on my mind because I suffered so much when I was going
Yeah.
through treatment. I suffered really badly with
Mm,
um, well, my worst thing was mouth ulcers, but I've always been kind of predisposed to ulcers.
yeah.
They were excruciating, um,
Mm,
and then when I went on treatment, oh my God, it just went through the roof to the point where some days I could barely eat or drink. And so many other people have said the same thing to me, that they
mm.
suffer or they're suffering now or they also suffered. And lots of people have said, you know, I think bicarbonate of soda was
Yeah.
one
Yeah.
thing.
Mixed with water. Yeah.
Waters, you have heard that. Is that something that's good for ulcers or is that good for just general?
That's actually really good for dry mouth and ulcers as well. So bicarbonate of soda has got healing and anti-inflammatory properties in that. If you mix bicarbonate like a teaspoon in water and even a quarter teaspoon of a bit of salt in that as well, they disinfect and they heal the mouth quite a lot.
Oh, really?
So yeah, so these are really good home remedies. And the good thing about this is that there's no anesthetic, there's no alcohol. It's a natural home remedy. So you're not going to get any other side effects from it, which is why it's really, really good and recommended.
Oh, that's good. That's good to know because I was kind of prescribed certain things, Gelclair and
Yeah,
um, Difflam rinse,
Difflam spray. Yeah.
and not very much seemed to touch the sides, unfortunately. But
Mm,
it took a while after my treatment as well,
mm,
kind of heal up. But I wonder if we start from the very beginning,
mm.
things that you can do or things that you should do once you've had a diagnosis. You were saying the other day to me that actually it's a good thing to get in to see your dentist. They should be part of your almost part of your treatment plan.
Yeah.
Because I actually went to see my dentist just before I started chemo, and they said one of my teeth was embedded, a wisdom tooth.
Yeah.
What we don't want is that to flare up whilst you're on treatment.
Yeah.
So let's just take it out now. So I ended up having that done a couple of days before I started chemo. Um, and they said that you know, having extracted it, they were really glad that they had done it. So what are your recommendations if somebody comes to you to say that they've got cancer, they're about to start cancer treatment, what should we do?
So I go through a thorough medical history, and then when they tell me they're about to start cancer, for example, we do a thorough checkup. So any treatment that they need doing should be done before they start any chemotherapy. Now, the reason for this is because, you know, from your side effects, for example, you get really painful gums, ulcers as well. If your oral hygiene and your gum disease is all stabilized before that, it will make those side effects a lot less severe. But the reason why your teeth needed to be taken out before is because lots of cancer patients are on a certain medication called bisphosphonates. Now, these medications can cause exposed bone not to heal after an extraction. So they're very, very strong medicines, which is why you need all your extractions, fillings, severe gum disease treated before this. Because if you get this really severe treatment while you're on the chemotherapy, there's complications with healing up of those sockets and your gums.
Oh,
That's why, yeah, that's why you need to get everything stabilized before you start your chemo.
Right. So what's it called? Bisphosphonates.
Bisphosphonates.
Oh,
So
if I was on that or not.
So have you got any of your medicines that you were on? Do you remember any of them on the top of your head? Did any of them end in dronic acid?
No. Paclitaxel. I was on. I did EC, which is
That is so joke. Right.
Call it the Red Devil.
Okay, so Helen, no, don't worry if you don't know the names. Say like you've started your chemo, your mid chemo, or your after. Take your list of all your medications and give them to your dentist, and they'll scan them on. And I look up every medicine if I even haven't heard the name of it, and we see what the medicines are, what category. So don't worry too much if you lot don't know what medicines they are. Take them to your dentist and scan them in, because these bisphosphonates, even after you finish chemotherapy, they stay in your system for over 10 years.
Yeah, really? That long?
Yeah. So if you're all clear from cancer and you haven't had chemo for 10 years, it can still be in your bone. So if you need a tooth taken out in the next 10 years, you can still have those complications, which is why you just got to go to your dentist. Even when you're all clear and had your chemo, go every 6 months, so you don't need an extraction, so you don't need any teeth taken out. Like, it's just, but take home message, go to your dentist every 6 months, before, during, after.
Yeah, it's funny because actually it's not I don't know about anybody else, but it's not really something that that you're told about.
No, you're not.
The other thing that kind of gets me a little bit is when you're on cancer treatment in this country, you get 5 years of free like prescriptions and sort of medical care afterwards. So any prescription drugs I don't have to pay for at the moment, not for another few years. But it's not the same for dental work, and it's so frustrating.
That's
the financial difficulty, you know, during.
Do you know? I totally agree.
Yeah.
I do not understand why it's not. I think it should be free, especially like if you're not working, you're sick of work. Of course, it should be free for that. And like, for example, pregnant women, of course, they should have free dental treatment, and they do a year while they're pregnant and the year after. And it should be a minimum of that for cancer patients. And I agree with that.
So do cancer patients not even get a year of it? I'm pretty sure they don't, do they? They don't get
anything. No, nothing. Absolutely nothing.
When one of the major side effects of cancer treatment are mouth complications.
That's the thing. So maybe that's something we can look into the future and possibly change that, because I strongly believe that should be changed.
Yeah. I can see us going and knocking on number 10 again.
Helen, shall we do it?
I think we should do it. That gold sparkly jacket.
Oh my God, 100%. 100%.
I know. What is your advice? So we've got our advice for once you've first been given a diagnosis, and you go and you check it in, you go and see your dentist. What can you do during treatment to maintain a good, I was about to say,
Right.
good mouth?
A good mouth, 100%. So I'm going to start with the basics. So you brush your 2 minutes morning and night, and you spit, don't rinse that toothpaste out. Now, if you've got painful ulcers, get a soft bristle toothbrush. You don't need a hard one. As long as you're getting that fluoride on that toothpaste and trying to clean it, do that. Okay. Cleaning between your teeth is important with floss or little individual brushes, because if you get a buildup of plaque and calculus that causes gingivitis, inflaming gums, that's going to make your ulcers and sore mouth even worse. So you need to clean between your teeth. Now, with mouthwash, for example, Listerine is a bit sore on my gums, but my parents find Listerine fine. Every mouthwash is different. You just need to see what works for you. Now, with mouthwash, you actually can dilute it down. So with water, yeah. If it's a bit strong, dilute it down with just a little bit of water, half and half, for example. And you must do mouthwash at different times to brushing your teeth. Now, a few years ago, I don't know what I had. I had lots of ulcers in my mouth. It came and went, and it was awful. It was really, really bad. So I can't imagine what you guys are going through. Now, to keep my oral hygiene clean, there's this cream called Oragel. So Oragel is a little cream, and it's got a bit of anesthetic in it. It's normally for a toothache, but you can use it on mouth ulcers. And this has got anesthetic, and it temporarily numbs it up. So when I needed to brush my teeth in the morning and the afternoon or the evening, I put it on, then I brushed my teeth, and then it wore off. So I only put it on as of when I needed, because it's only a temporary solution. But Helen, your ulcers were well bad. They look so painful.
And I had that on both sides. And that was just, I mean, I've got a million bloody photographs of them, but that was when it was particularly bad. But not only would I have that, but I would also get a load of like spots on my tongue. It was so...
Yeah, straw. So you would have had a straw.
Yeah. Oh, definitely. Yeah. I feel for anybody going through that, you know, at the moment. Would you suggest an electric toothbrush or a normal toothbrush, or doesn't it matter?
Electric one is definitely better, because with a manual one, it's very technique sensitive. So to brush your teeth, you have to angle it in your gum line and do it in a circular motion and move all the way around your teeth. With a electric toothbrush, it does all the round circular motion for you. You literally just hold it there, buzz it all the way across. So I definitely think electric toothbrush. And you know, some electric toothbrushes, they have really good heads that have got softer bristles on them as well.
Okay.
So yeah, so you can change the heads of them as well.
Good to know. So go softer on it. And so, you know, mouthwashes, sometimes you taste they can be quite, like you said, strong.
Yeah.
And you might not know this, you might not know to answer this. I know that when you're on treatment, there's certain chemicals and stuff that you should really try and avoid. There's nothing in mouthwashes there that would interfere with anything or be harmful, because when you put mouthwash in your mouth, sometimes it is a bit...
Yeah. So there is something called SLS. I can't remember the full chemical name of it, but it normally has on the bottle that it hasn't got any SLS on that, and normally that can affect something in your mouth and irritate it a little bit. Most of the new mouthwashes, pretty much none of them have them anymore. There are odd few that have them, but your Colgate, your Listerine, your Corsadils, most of them don't have them in that.
Yeah, it was Corsadil actually that my breast nurse said in their experience that was the one they had the best.
Yeah, because
they got the best day out of it.
Yeah, so Corsadil focuses on bleeding gums, but very important, Corsadil daily is good, but the other Corsadil that's a high concentration, that can actually stain your teeth as well. So limit how long you can have that for as well. Don't have it for more than 2 to 3 weeks. You're best doing Corsadil daily as well. That stains minimal or not much at all.
Something else that somebody messaged me about and said, to ask you, was they've noticed during treatment that their teeth have yellowed.
Yeah.
Is that possible? Would that be down to the chemo, or is...
That's a side effect of everything.
I feel like mine have.
Yeah, so your microbiota has all changed. Your bacteria in your mouth has all changed. It's a completely different mouth inside. So that's what's contributing to that color change as well. The
Oh,
only thing about that is a two-in-one is see your hygienist, but it's unlikely that that will make that get any whiter because it's within your enamel that is gone yellow.
oh,
Unfortunately, I would not recommend whitening until you're all in the clear and everything, but that's the thing that will probably get rid of that.
oh, okay.
Yeah.
You wouldn't recommend whitening then, not till further down.
No, not until you've done with your chemo and you're all clear, 100%, because that can irritate your gums as it is. So definitely not.
Yeah, it can make your teeth more sensitive as well, can't it?
Yeah, 100%, and you're gonna have more complications as well. So no, don't do that. Your teeth are looking nice though.
Ah,
They're
no,
not.
it definitely changed colour a bit.
Oh, they look nice and bright.
My daughter said to me, "Have you brushed your teeth today, Mummy?" She said this to me the other month. I was like, "Oh, they're a bit yellow." I was like, "Oh, thanks."
But do you know what? Natural teeth are yellow. That
Oh,
that's what your teeth are meant to look like. They're meant to look like normally yellow anyway.
a little bit yellow. Yeah, they're not. Yeah, I know, and they shouldn't look as like white as Simon Cowell's. I know because
It,
that's just somewhere in, you know.
they weren't turmeric yellow though, were they?
No,
All
not.
right, good. So that's all right. See, mine go that because of the curries.
No, they don't go that colour.
Not that bad, but they can do. I've got to sort my whitening out because I love my curries. That's the issue.
Oh, I love a curry too. So
I know.
last week I was doing an Insta Live with Bow Babe, and I don't know if anybody on here saw, but I had just necked a curry
That
with rice. I had a
there's
massive
something in your teeth.
the
Yeah.
the whole time. And it was only when I went back and I sort of caught myself in the mirror. I was like, what is that?
Was that spinach?
No, it was a black rice.
Oh my God, that is so jokes. I saw that. That was so funny.
I've had a couple of questions come
Oh
through.
yeah.
Also somebody said, oh yeah, where can I buy Biotene from?
Right. So Biotene, there's a mouthwash, there's a moisturizer, and there's a toothpaste, and you can actually buy that over the counter. So Boots, definitely
Okay.
do it and try some of the pharmacies. That's over the counter. That helps with your dry mouth. But you know, Gel Claire.
Yeah.
Now, Gel Claire, I researched. I tried to order it as a non-dentist.
Yeah.
So I went on gelclaire.co.uk. Now, with that, you need a prescription for that. Now, what
Right.
you do is they've got an email and they've got a telephone number. I think you can call them up and they'll be able to write your private prescription via their website.
Oh, okay.
Yeah. Or ask your GP if you can get a private prescription because I called up a pharmacy as well. They said they don't, it's private.
Ah, okay. Okay.
Yeah.
Right. Because I wonder whether if you're going in and seeing a breast nurse, whether they might be able.
They can. So yeah. So they'll be able to. So speak to your doctor or nurse in the hospital. They'll be able to sort that out. Yeah.
Okay.
But Gelclair's prescription. Yeah.
But Biotene is for the dry mouth.
Yeah. So with Biotene, it comes in a mouthwash. So that's just rinse when your mouth is dry. That's fine. They have a toothpaste, but that doesn't help with your dry mouth. But one really, really good thing that they do have is that they've got this little tube of gel. You keep it in your handbag and your bag. You just put it on your teeth and it sorts it straight away. It's really convenient when you're going out or something.
Right. So
Yeah.
what, teeth?
You swish it around, literally put it on your finger, put it on your dry area in your mouth, and it lubricates it straight away.
Right. Yeah. Because it sounds funny. As somebody that's never experienced dry mouth before, it's horrible. It is so. It could be so painful and debilitating. Because you do everything via speech, so anything mouth, it makes the whole of you feel horrible, doesn't it? I didn't suffer with dry mouth too much. One thing I did get was my taste buds were really affected, but I don't think there's anything that you can suggest on that.
So with taste buds changing, it's only oral hygiene and give it time. That's literally the only thing with regards to that. You know, things like ginger and spices you use, try and use a little bit more extra to get the like salivary flowing, your taste buds working a little bit more. Add a bit more than you would normally use to see if you can get things going. So
Yeah.
that has been shown to work.
Somebody just said I'm on the enlightened. Somebody's called the enlightened arsehole. There you go, my love.
Oh.
On immunotherapy and can't cope with spearmint or anything minty, would or could you recommend an alternative?
So with regards to chewing gum, have they tried chewing gum?
Don't know. Have you tried chewing gum? But I guess aren't they all minty though?
I'm wondering if you don't know.
Can't cope with spearmint or anything minty. I wonder why. If you can, enlightened arsehole, do so.
um,
And we'll try and answer that.
yeah.
What do you say? Oh, he hasn't tried. He said he hasn't tried chewing gum. Is that something you'd suggest then?
Yeah. So, sorry, I knocked that a bit. So, you know, people that have got a dry mouth, we actually recommend chewing on sugar-free chewing gum and sucking on sugar-free sweets.
Oh, right.
Yeah. So that's dental advice I regularly give to patients that have dry mouth for that.
What? Because gets the sort of salivary.
Yeah. It needs it needs as much stimulation as it can to get that saliva out. You know, like getting milk out of breasts, like you need to stimulate it out. It's the same with saliva. You need to stimulate it out.
Right. Okay. And probably something, the more you do it, the more it kind of like.
That's it. So the more you do it, and if it's sugar-free boiled sweets, that's fine. There's no sugar in them, and sugar-free chewing gum. So, and you know, chewing gum, minty chewing gum, it's a lot less harsh than the sucking mint sweets as well. You know, like mint, that's really, I think that's quite harsh as well, but chewing gums are a lot more better. And try children's chewing gum as well, and children's mints as well. They're a lot harsh.
Oh, okay, okay. So his saying is on. Oh, can you read those? That's the chemical, the drugs that he's on. Might have to look that one up.
I'll need to look that one up. I can look it up quickly.
Yeah. So I know that he messaged me earlier to say that he's really suffering with ulcers. I think it might be problems with dry mouth, but I'm not sure. Joined us just to recap, because I know a couple of people that have just come on here have very recently started treatment or about to start treatment. It's really worth going to see your dentist before too long, just to get yourself checked and get yourself in start cancer treatment, and then see a dentist for one reason or another. And we don't want anything like holding up your chemo treatment or anything holding up any sort of dental work as well, right? Like it's
actually, Helen, I think it was about 2 years ago that I did have a patient that was referred from a hospital, and their chemo was delayed because they had to have teeth taken out before. So it's what you said.
Yeah. So I was exactly the same, and mine nearly got delayed as well because it took a while. I got, what's it called when it can get affected? I want to say dry root.
It's pericoronitis, when your wisdom tooth the gum around it gets infected.
Yeah.
And it's a dry socket when the tooth comes out and it gets infected. That's it. Yeah.
Oh, it was so painful. Oh my God.
Oh God, you got that?
Yeah.
Do you smoke?
No.
Oh no, dry sockets are really, really painful.
Honestly, I was like this, like talk about kick a girl when she's down. I'd had my mastectomy, about to start chemo, and they were like, the dentist said we're gonna have to out.
Oh, Helen, actually, you know why you're talking about that? So you said you got a dry socket. You know, if you have to have your tooth taken out while you're mid chemo and you're on those bisphosphonates drug, you getting a socket that's not healing is as painful, or if not more, than a dry socket. So That's
Uh,
because your bone doesn't heal at all. So a dry socket, it can heal,
yeah.
but with that MRONJ thing, that bisphos osteoradionecrosis, that's the word for it.
Yeah.
Um, yeah, so it's very important just to get all your elective work done before, and
Yeah.
or as early as possible. So say like you started chemo, don't worry, just let your dentist know, go for your checkup.
Yeah, yeah, definitely. Somebody's laughing at me. Victoria's laughing at me because I said that it was dry rot in my mouth. No, it was dry socket. I got it wrong. I don't have dry rot in my mouth. That would be weird. Thanks.
Yeah.
Oh, Josie is saying that she used milk teeth, children's teeth,
Yes.
whilst on chemo. That's actually a really good idea. I don't know why I didn't think of that.
No, so that's the thing. So we've got to be a little bit careful with that. So it's better than nothing. So if it works, go for it. But you know, in chemo, you have reduced saliva. Now,
Yeah,
your saliva protects your teeth from getting decay. Okay.
yeah,
Now, your toothpaste has fluoride to protect against all the decay and everything. Now, children's toothpaste has a lot less concentration of fluoride. It's for milk teeth.
yeah.
So you need to make sure all do that, but just go for your regular checkups, but keep your sugar intake none or medium or as mild, as little as you can.
Right, okay.
So that's the issue with that. It's the fluoride concentration to protect your teeth. It's a lot less in milk teeth children's toothpaste.
Ah, okay, okay. So
Yeah.
I was told to use the Arms and Hammer one. I think it was like a bicarbonate toothpaste. Would that be right?
Bicarbonate toothpaste. I can't remember the name of that on the top of my head, but that's just as good. That's fine. But make sure there's got fluoride in it though. But the good thing about the bicarbonate one is that it's less harsh on your teeth because if fluoride-based toothpaste are painful, you've got no choice but to use that one.
Right.
So it's the risk. It's the risk outweighs the benefit.
Right.
Bottom line is if your sugar intake is minimal or zero,
Yeah.
don't worry too much. But if it's high, we need to think about getting that fluoride on those teeth.
Okay. What about diet things? So you're talking sugar intake there.
Mm.
Would you recommend to your patients that, you know, especially whilst going through cancer treatment, you know, think about X, Y, and Z in your diet? Is that something that you have a conversation about?
100%. So, say for example, you have a can of Coke, okay, and you sip it over 2 hours. That is so much more damaging than you just downing that Coke within 1 minute because you have to reduce the frequency at which you have sugar. Like, don't graze, don't sip it slowly throughout the days because the more you sip it throughout the day, the more your tooth's going to be exposed to that sugar. So it's the frequency. Reduce the frequency you have. If you have to have sugar, reduce the frequency. Have it quick, short, sharp, swallow it, that's it. Don't graze on it. But if you can reduce that sugar, like Coke, sweets, chocolates, biscuits, reduce it all. If you have to have a sugary drink like fruit juices and smoothie, have a straw so it goes straight to your throat. It doesn't touch your teeth. Now, tomato ketchup and things like that, they all have hidden sugars in them. You need to watch out for that as well. So it's all hidden sugars that you need to read the label, cut them all out as well.
What about, you know, earlier on you were saying about sugar-free chewing gum. What about
Yes.
sugar-free, like Diet Coke, like sugar-free?
Yeah. So that's fine. That's better than normal Coke. But don't forget, it's still carbonated. It can still cause a bit of erosion on your teeth if you have a lot of carbonated drinks, right? But have it in moderation. But definitely, it's a lot more better than the sugar-filled fizzy drinks, 100%.
Right. And what about natural sugars in like dried fruit or fruit juices or whatever? Is that the same?
So
Do it,
yeah.
and then
So with them, eat them in moderation. So yeah, they're natural sugars. Yeah, they're not refined, but even fruits and everything, having them in high volumes, it does affect it. But if you have them in nice, healthy moderation portions, then it's absolutely fine to have them. That's no problem. And when someone eats or drinks something sugary, wait 30 minutes to 1 hour and then brush your teeth because these sugars soften up the enamel and it takes 30 to 60 minutes for your enamel to harden again and then you brush your teeth.
oh, I didn't know that.
No one literally, all my patients, I say that to them, I had no idea about that because there's not enough exposure about this information. That's the thing. So not many people are aware of that.
Because you'd think that if you're gonna have eaten something like that, it's best to brush your teeth straight away.
Yeah,
So that could
yeah.
be harmful.
Yeah, very, very harmful because you're brushing a really soft enamel away and it can rip it away, create more sensitivity as well. So
Right.
yeah, wait that 30 to 60 minutes. Brush your teeth just before going to bed. That will
Right.
keep it simple. And before breakfast, done,
Okay.
sorted.
Okay. Now, something else that somebody sent to me today to mention to you was when she went through chemo, she said that so she was on a 3-weekly cycle, and she would change her toothbrush every cycle because she didn't want to sort of reinfect herself. Is that something like, would your toothbrush carry germs that can then give you an infection, or because
If it's your own toothbrush, that's absolutely fine. So if it's your own, it doesn't spread like that, or it won't reinfect it like that again.
okay,
So that's absolutely fine. But there's no harm in doing that because you should change your toothbrush, I'd say once a month, well, until your bristles get flat as well. There's no harm in changing your toothbrush. So it's better to be safe than sorry. So there's absolutely no harm in doing that.
Great, okay. A couple of other questions that have just come in. Minnie Mason's asking, can your dentist do anything to your teeth to protect them during chemo, like a fluoride varnish? I've never even heard
Yeah.
of this. Does that exist?
So what we do is I do a couple of things based on each individual patient. I can prescribe them a very high fluoride toothpaste, which is only through prescription for your dentist. And the other thing you do, I do actually do fluoride varnish on some patients. So fluoride varnish is for children, is to protect their milk teeth. And if they've got a high sugar intake, it just gives them extra protection. But if an adult needs it, we are able to do that on them as well. So yeah, fluoride varnish is just a little application we do in the surgery. Don't eat for 30 minutes and let it sink in. And that is really good for prevention. So yeah, that's really, really good.
Does it hurt or not?
No, you should dry your teeth, dry them, and put it on with like a little micro brush. Done.
Almost like nail painting, but on your teeth.
Exactly. That's what I say to my children. So I'm going to paint your teeth now. And they're like, okay, great. And do you know what? The good thing about it is they come in really nice flavors. They come in banana, toffee, cherry, strawberry, watermelon. Yeah.
That's
I know.
that I'd love to do. A bit like paint by numbers. I'd be like,
Yes.
that's a question. And Jamie is asking, does radiotherapy affect teeth and gums?
Oh, hi, Jane. I know Jane. Jane's my mom's friend. So, yeah. So, Jane, it depends where you're getting your radiotherapy. So if it's around your head and neck, it will really affect the bone. So, for example, like I said, if you needed a tooth taken out, for example, it will really affect the bone of the area. If you're getting radiotherapy, anything from like your chest down, don't worry too much about that. It's more from your head and neck region. That's when you should be worried. But anything down there, don't worry too much about that. But still let your dentist know, obviously, about what treatment you've got. Yep. So, Jane, I hope that helps.
Yeah. I didn't really get any sort of mouth side effects from radio. The other thing I think affected my mouth was the fact, because where I was pushed into an early menopause, everything. I don't know whether menopausal women come to you to say, go through the menopause and my mouth feels affected.
No. So with menopause, one thing I found is that your gums do change a lot. So I have noticed quite a lot of recession in my patients that have had menopause, and they do get dry mouth. So every
gum recession.
Yeah, I've seen that.
Yeah.
Oh, yeah. Do you see? So menopause is really stressful on a woman's body. It really, really is. It has so many effects, and dry mouth and gums. I've seen it with my eyes. It's affected it because I've seen oral hygiene is immaculate. They've been coming to me regularly, but within like 2 or 3 years, the gums recede a bit.
Wow.
With that oral hygiene, we can't really do much. Just keep your teeth as clean as you can. See your hygienist as well. But with the dry mouth, if you're having chemo and menopause, it's hard.
Yeah.
It will be difficult. But just as dentists, we can also prescribe you some saliva substitute. Orthana is a really good one that I prescribe, and I've had really good feedback from that. That's prescription only. Orthana, yeah.
And that doesn't contain any sort of estrogen or anything like that in it?
No. It's just a saliva substitute.
Right, now Charlotte Kitters is asking, any tips on having some ulcer busters to hand or soothers, something to keep it at bay?
So, like I said before, only temporarily is Orajel, but Bonjela, I've had really good feedback, and I've used that on myself as well. Your GP would be the only one that can prescribe you steroids if they do get really, really bad, but that's something for you to discuss with them because I haven't got too much information about that. So
one thing that I found was quite handy is Boots do like a Bonjela, but it's in a pen like stick like this.
yeah,
And twizzle the end.
twist it and it comes out. Yeah,
come up on the top. So what you can do is you can get to the parts of your mouth that
easier.
Much easier. And if you're out on the go and you don't want to be sort of applying it because you can't clean your hands or whatever, this thing, and in fact people thought that when I was doing the school runs and stuff that I had like one of those rats or something in my hand because and then I'm like, I don't smoke, it's for me ulcers.
Like a baby.
Because it was that bad.
That is so funny.
So I hope that helps, Kitters. Josie, what advice can you give for general good oral hygiene after chemo if your taste buds are still affected and mouth is a bit sensitive? I wonder whether it's for what I did is I kind of kept doing the same thing as I was doing during chemo. Like I kept everything very mild and gentle. But what would you say?
With the basic oral hygiene.
Yeah.
So
like
with that. So what was that, Helen? It got cut off a little bit.
Oh, sorry. Like post chemo.
Oh yeah. So do you know what? Oral hygiene is exactly the same before, during, and after. It's just it's the brushing twice a day. But if you can see your hygienist, because when your mouth is feeling a little bit better, you've probably got to build up in areas that you don't know you've got. So I recommend booking an appointment with a hygienist just to get a proper, thorough clean of that, and then hopefully maintain it afterwards. Flossing, remember, clean between your teeth, 2 minutes morning and night, spit, don't rinse. Yeah.
Yeah, and actually, Joe, I know you asked a question earlier about things that you can do before you start treatment. Would you agree that going to a hygienist is probably a good thing to do?
Yeah.
Go into it.
100%. If your gums are clean and you've got no dental issues, 100%. But you know, without chemo and everything, if someone's got gingivitis, if they're smoking, their gums are so sore. So guys, if you're smoking, stop the smoking and stop the alcohol, because that affects your gums. I'm talking about going teetotal while you're doing it if you can.
Really? God.
Yeah. Oh, was it Audrey? Is that Audrey's?
Yeah.
Yeah. So use mouthwash at least at least an hour after brushing your teeth, because if you use mouthwash straight after brushing your teeth, you're washing away the toothpaste.
Oh, fucker.
Yeah. Oh my God, Helen, have you been doing it straight after?
Well, to be fair, I ran out of mouthwash so long ago. I only bought it. I can. I didn't realise that.
Yeah. No, you're not the only one, Helen. No one, literally hardly anyone knows that. You're not the only one, because everyone's in that habit.
Yeah, I mean, I guess it makes sense.
Yeah. Do you want to know when I do it? Just to keep it simple, I just do it after my lunch.
Oh, okay.
Like I eat my lunch at the start of the hour, then at the end of my lunch, I just do a quick swig before I go back to work.
Right.
Like not swallow it, rinse it and spit it. Yeah.
So just randomly, I know you just said about people smoking. So you obviously sometimes you get people come in and they've got stinky breath. Do you wear the mask? So all this uproar about everyone wearing masks, and I keep thinking dentists wear them every single day, like forever.
I know, people need to chill out.
I know, out right. But do you wear the mask so that you don't? I always think, are you wearing that because you don't want to smell my breath, or are you wearing that because you don't want me to smell your breath?
No, we wear them so we don't like inhale any of the aerosols in there. It's nothing to do with smelling, because trust me, Helen, trust me, that mask does not block the smell. So it's like, it's just to make sure we don't get anything in our like in us. Yeah.
So when you're concentrating, sometimes I've been known to, like, if I'm really concentrating on something, I dribble sometimes.
Yeah.
So as a dentist, when you're leaning over somebody, like really like concentrate,
Yeah.
dribble on them. So anyway,
Oh, it stops it.
we digress. Oh, Kittis is saying some mouthwashes can stain your teeth. What's the best stain-free mouthwash?
So Oral-B mouthwashes are excellent. I've had really good feedback. I use Oral-B myself. I've been using it for a long time. So yeah, definitely go through them. They're really good.
Not really expensive either, is it?
No, not at all. No.
Right. Has anybody else got any questions? I'm just through to make sure I haven't missed it.
Helen,
Yeah.
literally, I just finished a diploma in mindfulness, right? Because, yeah. And did you know that there was literally an entire chapter in that about patients on chemotherapy?
Is that right?
Yeah.
What, to do
So,
with mindfulness and dentistry, or is this like completely on the side you did?
oh, this is just something on the side because I know I've heard such good things about mindfulness. I just did it for my own mental and physical health because I've heard of it's got amazing benefits. But there was an entire. I'll send it to you because I've saved it in the area. Because it's got so many health benefits. It helps patients while they're going through chemo. So it helps manage the pain and everything. And they've got papers to prove that it helps with that as well. Apparently. So I'll dig through it and I'll email you. But that's one thing that stood out for me. And since I've been doing mindfulness properly, it's helped me mentally and physically with everything. I'm so much more happy, and it has got health benefits as well. But it really stuck out for me that it was chemotherapy, and I did think of you. It was only last week I did that, and I think it comes under lifestyle.
Yeah, I think it does, and I think that when you're sort of catapulted into the, when you get given a diagnosis, it's kind of fight or flight at the thing. It's like, okay, I'm going to have this surgery. I'm going to lose a boob. Okay, I'm going to go and have chemo. Right, da, 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 da. But you don't actually come up for breath at any point. So no one tells you about going to see your dentist and hygiene and da, da, da. And by not doing that, your complications can get worse. It can make the experience even more rubbish than what is already a rubbish sandwich.
100%. Yeah.
This side of it is really important because it's another thing that's not addressed enough is just actually how are you and
yes,
and I've said here a lot that you kind of not intentionally, but you're made to feel like that you're lucky to be like alive and you're being treated and you're going to be all right and da-da. But it's like, yeah, but this was something in my body that was trying to kill me. It's like it's surprised that such a high number of people go through PTSD after getting a cancer diagnosis, and it tends to kick in after treatment's finished, which is really interesting. So yeah, I'm with you on that. I think mindfulness is, and actually I knew that I was stressed going through my treatment because I was waking up with a really sore jaw and I was obviously
grinding,
gritting my teeth.
Right.
That must be something as well that other cancer patients, I expect, probably.
Yeah. Do you want a few home remedies for that? Very, very simple. Is a soft diet until the pain is a bit elevated. You can massage this area here. It's really, really good to do that. Hot and cold packs, use a hot water bottle, and anti-inflammatories like ibuprofen or whatever. And there's also really, really good exercises on YouTube called TMJ exercises. TMJ is the name of this joint here. So it's your temporomandibular joint. Yeah. And then if you YouTube TMJ exercises, just watch it once or twice, then you just do it in front of the TV, because I suffer from grinding a lot. And obviously get your night guard made as well. Right. If you can, from your dentist. But these home remedies have really helped and reduce that stress, if you can.
Do you ever recommend going to see a chiropractor?
I'm seeing one next week.
Interesting. So I saw one of my
Yeah,
chiropractor, and I swore by going to see her during it,
yeah,
because
yeah,
whatever she does in your mouth to relieve whatever it is she's doing, it was bloody.
yeah.
It really worked. Really helped relieve headaches and sort of painful jaw.
Did you get pain here as well? Did you get all your pain around your neck?
No, not really.
Yeah,
No,
okay, okay.
but I had
Yeah.
headaches and sore, sort of sore jaw.
Oh,
Right.
oh God.
Anything else? Mindfulness. Oh yeah, great things for a bad day. Yeah, you're right. Mindfulness is so important. Saltwater mouthwash. Somebody was suggesting.
Yeah, that's really good. Really, really, yeah, I recommend that.
Oh, the Booby Bunch said that she sucked on an ice pop while starting her transfusion for the first 15 minutes. I wonder why you did that. I wonder if that's for dry mouth. That's probably.
So those they have, is it ice bars? I think they're called. They really help soothe the pain for mouth ulcers and really ice sticks. I can't remember what they are called, but they're really, really good for that. You know how like ice numbs up your skin a bit? It's for
Yeah,
that, and it's really, really good.
yeah. Somebody else saying a dissolvable paracetamol and a salt wash helped.
Yeah,
Uh,
painkiller. That,
oh, Manuka honey, somebody suggested on
oh, yeah.
ulcers. I had very
Okay.
strong. Um, yeah, she was on very strong chemo, and she used Manuka honey from the
Okay.
herbalist. Yeah, have you
It's,
ever?
it's it's organic. I haven't come across that before.
No.
No. But if it helps and there's no chemicals in it, go for it.
Yeah, yeah. Cavita Blue, would you recommend biotin? Yes, we were talking about it earlier, and absolutely, that was something that Aminda definitely recommended.
Yeah.
Um, an Oragel, Nick Nat Lou. So
Yeah. Say Oragel.
yeah, and she'll be the expert because she probably gets
Yeah.
those quite a lot. So I
Yeah.
everybody's found that helpful. I've definitely learned lots of things, even if whether you're going through cancer treatment actually or not, it's just really important that good oral health. And you know what? We've had a really steady number of people watching this, and I was really interested because I thought, sounds really dull,
Yeah.
really not. And I had so many people messaging me asking me questions about
Yeah.
find out about this, that, and the other. So I really, really appreciate it. And I wonder whether it's something we do again further down the line. There might be more things that come up.
Oh, Helen, yeah, 100%. I'm always available. And I think it's really nice because people aren't aware of this stuff, and it's just so nice for them to be informed about it.
Yeah, definitely. And it's like I say as well a lot, that it's just nice to know that there are choices out there and things that you can do
Yeah.
to help the situation that you're in. So yeah. So Amrita, thank you so much. I will be posting this on my grid and I will tag you in on it.
Yeah.
And I'll send it on to you as well. And I shall meet
We've got to do this again, Helen.
definitely. Well, let's meet for a cup of coffee as well at some point.
Yes. Yes. Look after yourself.
Yeah, and you. And thank you ever so much for everybody that joined us. I really, really appreciate your time and your support on that. All right. Loads of love, everybody. See you later.
Bye.